if you don't sweep around your own front doorstep first, you can't go sweeping around other people's doorstep. You've got to provide for your citizens first.
Heroes Pub in Goose Creek, South Carolina is a place where people come to talk, drink, listen to music, and shoot some pool. Patrick Hancock owns the place. We first met a few years ago, and I'm back to see how he's doing. I'm here in this rural pocket of the American South to hear about the pandemic's impact and Patrick's view on COVID-19 and the COVID vaccine.
So, yeah, let's just sit here. So what's changed since I was here last?
Business is booming.
Why? Why?
Do the simple things. Do the simple things day in, day out. You don't change the way you operate. You don't change the way you treat your people. You just treat people fairly and honestly. And no matter what, you're accepting of everything. I'm accepting of everything except stupidity. So as long as people aren't stupid, they're welcome under our banner.
And which banner is that? Is that
the gay, straight, black, and white, man. If you're a human being created by God, you're welcome in here until you act stupid. You ask what's happened since then? Since last time I talked to you? The Rona happened.
Let's be clear. When you say the Rona, you're talking about COVID-19, the coronavirus.
Corona, yeah, whatever. Never really had any fear for it myself. Of course, then again, I got Jesus in my life, so I don't have a lot of fear and a whole lot of anything, you know. But if you look around the room, here's what we did. When they stopped us doing business, I did the best thing I could do for my employees. I kept them working. We ripped up all the old carpet. Notice it don't stink in here anymore from the 30-year-old carpet. We washed all the walls in here. You see all the camouflage all over the walls? That's because we painted all the walls. We changed out ceiling tiles. We changed the motif. We painted the bathrooms. If they were wanting to come, everybody could come, and I was paying them $15 an hour. Wrote them a check for $15 an hour, no payroll. Just
kept people working.
Kept it working, man.
Patrick had been saving to open another business, but instead, he dug into that money to keep his employees paid during the shutdown. He seems to really care for the people around him. And I'm curious what he thinks about the people suffering from COVID all around the world. People who don't have access to the vaccine. The music does really add to the atmosphere. But to talk, we head upstairs to what Patrick calls his dungeon, AKA his office.
We're going up to the up
into the dungeon, man.
Up to the dungeon, okay. So let me ask you this. I asked you the question about America first, right?
Absolutely. Doesn't your family come first to you?
Sure.
Doesn't yours and your neighbors then come next? And then your community comes next, and your city and all those other kind of things.
Duke University's Global Health Center reports America has primarily used just that approach to the COVID vaccine. America first. Get as many doses as possible and prioritize vaccinations for the U.S. And we weren't alone. By early 2020, high-income countries secured almost 60% of the vaccine doses globally, even though those countries hold just 16% of the world's population.
Here's what I'm going to do. I'm going to keep believing in the Lord. I'm going to keep doing what I can do for my family, my community, my employees,
But we're not going to send vaccines to other parts of the world.
Why would I want to? If I don't believe in it here, man.
From West Virginia Public Broadcasting and PRX, this is Us and Them, the show that tells the stories about the things that divide us. I'm Trey Kay. In this episode, we explore the divides the COVID-19 pandemic seems to have widened, like the gap between those who have access to vaccines and those who don't. Instead of bringing us together, has a global crisis just split us further apart? I talked with Patrick Hancock in South Carolina last fall. Just a few months before that, and about 8,000 miles away in Gurgaon, northern India, a man who is not part of Patrick Hancock's family or his community or his city sat in a room watching his grandmother inch closer to death.
With my left hand, I am holding her hand, which is gently pushing against my hand constantly through the night, every day, trying to get her mask off while she is semi-unconscious or sleeping, jumping in from one to the other. I am constantly, every 15 minutes, monitoring her blood pressure and her oxygen levels. I am switching off the oxygen concentrator every half an hour to allow her lungs to work on their own a little bit.
Amitoj Singh is a longtime journalist, and he was living in New York City when the pandemic hit. He came to the U.S. for a master's program for mid-career journalists and experienced pretty much the worst of COVID here. He got vaccinated in New York well before the general population back in India.
So what was your experience like getting a vaccine?
Look, I'm from India, and in India, there's a word called jugaad. Jugaad means somehow making things happen and work, just figuring a way out. And that's what I did. And I didn't get an appointment. What I did was I just went there and sat there and said, hey, can you give me one if you have a free dose at the end of the day?
You basically just camped out until you got a vaccine.
Amitoj felt guilty that he had a vaccination and his family did not. But he sent them a photo anyway.
It was a moment of confidence for them too, because they felt, okay, one of us has got it. It's going to come. It's going to come to India.
Then Amitoj found out his grandmother had COVID. He also learned his father was sick, possibly with COVID. His sister and granduncle had COVID too. He decided to fly back and help. Friends and relatives told him not to go. His second vaccine hadn't kicked in yet. And the COVID wave hitting India was devastating.
I called my brother-in-law and he said, don't come because the moment you land at the airport, you will get COVID because it's in the air. It's everywhere. I called two of my closest friends and they said, what's the point of going? You will not be able to help.
Those words rang true when Amitoj arrived at his father's home.
I entered the room of my grandmother. My father was overlooking her. She had an oxygen concentrator right next to her. The mask was on her. They were trying to give her some food and medicines. And at the same time, my dad had put an oximeter on her index finger to measure her oxygen and her blood pressure. And as soon as she saw me, my father said, look who's come from America to see you. And that was the last time I saw her smile.
Listening to Amitoj talk about trying to help his family, I'm struck by a question. How did we end up here? Why has there been access to vaccines in the U.S., even when people refuse them, when so many people around the world continue to wait? For answers, I turn to one of the world's top experts in global health.
Can you tell me who you are and what do you do?
Oh boy. I'm Wafa El Sadr, and my titles are, so I'm infectious disease physician by training and epidemiologist. And I'm a professor of both epidemiology and medicine at Columbia University. I'm also the director of a global health center that I established here at the School of Public Health now 20 years ago.
What do you think about the global approach to vaccine distribution?
Well, I think it's a shame. It's shameful. I mean, I think in a lot of ways, I always feel that there's an argument for vaccinating the world that's because of issues around doing the right thing, right? But I also think it's very much about self-interest. I mean, I think this is a transmissible virus. Wherever you have ongoing transmission, large numbers of cases of this virus, you're going to get new variants. because that's how new variants of the virus arise. And you always get the risk that these variants are going to be able to outsmart our vaccines. So it's in our own self-interest to really vaccinate the world as quickly as possible to suppress transmission.
The U.S. and many other wealthy countries bought up a large supply of the vaccines early on.
Right.
I mean, what do you think of that kind of, I guess in America's case, there's an America first approach. What do you think of that?
I think it's natural for leadership in a country to want to protect their citizens. And obviously the U.S. government has invested a lot in making these vaccines. That's different from not seeing the rest of the picture. Several countries are what's called hoarding vaccines or have a surplus of vaccines or not investing enough to actually produce more vaccines. We have enough vaccines for our country. We have more than enough vaccines for our country. And we've had more than enough vaccines for quite a while. So a lot of us have been pushing and saying there needs to be a supply now, invest in building factories to produce more vaccines for the world. Because it's the right thing to do, but it's out of self-interest. And I think that's been the problem is that the U.S. has given donations. Other countries have given some donations. China's given some donations, but it's really is a drop in the bucket, in terms of the amount of vaccine that's really needed to get to the level of vaccination we want.
I feel like that my fellow Americans have a tendency to not be able to look very far beyond our borders. Is that dynamic part of the problem that in many ways, yes, it's one thing for our government to respond or not respond, but it's another thing our citizens need to feel it too, that we're all in this together.
Yeah, and I agree completely, but that requires leadership to motivate people to think that way. And there's nothing like COVID that should motivate you to think that way. I mean, it's shown that, we can't build walls around this country. The virus moves, people move. It's essential for our economy to move across borders and so on. So the idea that we can just focus on ourselves and solely for us is untenable in the world of today, the interconnected world of today. But it takes, it takes leadership to motivate people to think beyond their pure self-interest, And I do think that most people, I personally I'm an optimist, but I think that most people, when they understand the implications, can be quite generous. And I do think Americans are generally quite generous overall.
You've traveled to a few countries recently. What have you seen in terms of vaccine access and COVID?
Very limited. I mean, there's countries I've been to where 2% of the population is vaccinated, 6% other countries. It's very limited supply of vaccines. There are not enough vaccines.
How do we make vaccination distribution more equitable?
Certainly, wealthy countries like the United States should put the money to increase the production. The problem is really supply. The major stumbling block is the supply of vaccine, not having enough vaccine. That's the major stumbling block now. And that's what I see when I travel is, people always say, but will people know how to give vaccines? Do they have refrigerators? Do they have freezers? You hear all these kind of naysayers. Right. I know what I see is quite, as soon as a supply of vaccine arrives in the airport, they know what to do next. They're ready and they've gotten the vaccines into people's arms and so on. It's just a matter that there's not enough vaccine.
Is there blame that can be laid on other countries that bought up all this vaccine and didn't leave any for the
rest of the world? Yeah.
Yeah.
I think what countries were doing, particularly the U.S. and Western European countries and other countries, they were just buying up, pre-ordering a lot of doses of vaccines, and they really didn't know which one was going to work and which one wasn't. So they were hedging their bets, So they would say, we promised us we're going to buy 100 million doses from Pfizer and 200 million from Moderna and 300 million of AstraZeneca. They essentially cornered the market in a way.
Right.
because they weren't sure, nobody knew at that point in time who was going to be the winner, who's going to be actually have a vaccine that works. So what ended up happening is you have countries that have an oversupply now of vaccine doses.
After a break, a Somali-American nurse practitioner talks about how COVID is ravaging the country she left as a child. And a recent trip back to Somalia reminds her how connected we all are.
If we take care of the other worlds, we are taking care of ourselves too, because once we vaccinate the world, then we're all vaccinated, right? We're all protected.
I'm Trey Kay, and this
Music lifts us up and brings us together, even when we can't get together in person. Mountain Stage brings you live performances on the air, online, and in our podcast. They remind you how it feels to be in a live audience listening to live music. This is Larry Gross, host of Mountain Stage. Find a link to our stations and our podcast online at mountainstage.org.
Hey, I'm Trey Kay, and you're listening to Us and Them from PRX and West Virginia Public Broadcasting.
So kids are playing soccer, and the coach is probably with them. He's right there. And this is the soccer field close to really downtown Minneapolis. So these kids are probably all born here, and this is their world. Probably they have no idea what Somalia is like. It's like my son. He doesn't know anything about Somalia.
Misbil Haji Salad is Somali-American and lives part-time in Minneapolis, Minnesota. Misbil is a nurse practitioner and works two jobs, one at the University of Minnesota Medical Center and one at Sibley Memorial Hospital, part of Johns Hopkins in Washington, D.C. Our producer, Emily Havik, talked with Misbil.
You've been in Minneapolis about 5 or 6 years, you said?
Yeah, but I lived in Rochester at least 21 years. I lived in Italy, lived in London.
You've been all over.
Yes. When you actually go through civil wars, like you're a tree that's been just pulled its roots so quickly and you kind of get lost. You get displaced.
Misbil recently returned to Somalia to see how the healthcare systems in her childhood home have fared during COVID. Emily got me on the phone so we could talk together.
All right, I'll give Trey a call. Hey, Trey.
Hi.
Hi, I'm with Miss Bill right now.
Hi, Misbil.
Hi, how are you?
I'm good.
So, Trey, I'm throwing my hat in the car because it's very warm in Minneapolis today, and then we're gonna go sit down in the community center. Yeah, over here. Great.
So you're in Minnesota, Minneapolis part-time, then you cross the time barrier or the time divide, and then you go work in Washington? Is that how that works?
I have family here, so 1 week I am in DC, and then the other week that I'm off, I'm here in Minnesota.
They say that some people like to live small and some people like to live big. I think
Yes.
you've chosen big.
Yeah, we can all decide how large we would like to live or how small we would like to live, and it's nicer to live in two different worlds and different cultures too.
So you're originally from Somalia. How was it that you came from Somalia and ended up in Minnesota?
Long journey. Civil War broke when I was about 12 years old, and
Right.
Part of my family migrated to Europe, and the other part migrated to United States. So I was the part that migrated to Europe, and then later I joined my family who were here in Minnesota.
Recently, you traveled back to Somalia. Well, why did you do that?
Well, when we flee out of the country, it was really a horrible, and I've seen enough things that a child shouldn't have seen. And
Right.
first 7-8 years that I was out of the country, I was having nightmares and had a little sleep, but then after a while it faded away. But I always thought, Somalia is really like disaster, like just in my mind. So it was my curiosity, some sort of healing for me, just to go back and kind of just get that image out of my head. We can't just fear forever.
So when you went there, I understand that you visited medical facilities. When you did, what did you find with regard to the COVID situation in Somalia?
Many people live in a rural area, and there are no transportation, like no reliable transportation. And the roads are not that great either. So people can't make it to the hospitals. And then also hospitals are limited. Like the region I was at, they were saying there was a whole city called Qardo. That's a city that you have 50,000 people live there, and you only have one room for COVID patients. So that's a lack of resource, right? Lack of hospital. Garowe, which is a bigger city, had more resource. And then even Garowe, the biggest hospital, was running out of oxygen. And people would not get oxygen until next day.
So what do you do?
That's why people die, because they can't get an oxygen. I mean, let alone ventilator. They don't even have an ICU. The whole hospital doesn't even have an ICU. So if you get that critically ill, you're just gonna die. People ask me, say, like, you should come and practice here. And I'm like, no, I wouldn't be able to function. And it would be for me to really watch people suffer. Imagine when you know you can do something, and something that can be done, and you're watching that person die.
So this isn't really an issue in Somalia right now about getting the vaccine or not getting the vaccine. It's, in many ways, it's about fighting the symptoms of COVID.
Both, yes, treatment limitation and vaccination limitation too. So an area that I visited, basically 3 to 4 million people in that area, and they only had 140,000 vaccines.
That just seems like a drop in a bucket.
Correct. And here we have, because vaccines, like, they have life shelf is like 6 months or so, we really like wasting vaccines, and those vaccines could be really used. It seems like it's a faraway land, but it's really not faraway land. Really, whatever COVID numbers or whatever that's going on in Somalia will eventually come here. So I always say, if we take care of the other worlds, we are taking care of ourselves too, because once we vaccinate the world, then we're all vaccinated, right? We're all protected.
So, Ms. Bolt, we've been inside the community center. Can you just kind of take me out and kind of walk me around a little bit of the community that you live in?
Sure. Yeah, South Minneapolis. This is the area where many Somalis actually reside.
So, can you hear me?
Yes, I can. Kids are playing actually outside in the playground. Some of them are getting into the car. Some kids are being dropped off by the bus, because this is the time everyone comes back from school.
What's it like having a foot in both worlds, with people of Somali culture in America and then people who are actually in Somalia? What's it like?
Well, people that are here have much more resources than the people that live there. I mean, I wish I could help. I wish I could transform the healthcare there. I wish I could just go back tomorrow and take basic things. Like diabetes medication, more COVID vaccine, childhood vaccines, simple things. I would start with simple things.
Do you think that you would go back and try to help?
If I can get some things, I will go back, but I won't go back with empty hand again.
I'm wondering, what responsibility do you think that the U.S. has when it comes to this global pandemic and getting vaccine distributed to a place like Somalia?
I think in order for us to not go back to where we were in last year, the world should share. If the last year did not teach us a lesson where everyone was locked in their own homes, afraid of what is going to be, I don't think people remember what it was like last year. It was fearful. Everyone was fearful for their life. I used to go to work not knowing if I am going to pick up whatever that bug was, which we did not know what the bug was. Right. It was a scary time, right? If 2020 did not teach the world anything, did not teach the world to be less selfish, I don't know what would teach the world.
People in the United States are getting booster shots, while other countries haven't even rolled up their sleeve to get one, or maybe they've only gotten one. And you've lived here in America, and you've heard probably some of our political campaigns where people who've been in America for generations, they want us to take care of Americans first.
Because I'm an American, I want America to take care of me. We have what it takes to take care of the world and us. You can't close the border. A lot of people feel like we should close the borders. No, America needs the world, and the world needs America's technology and advancement. And America needs the world's resources. You cannot do anything without getting Africa's resource or South America's resource. So nobody can close the border. A lot of people don't realize. I don't know what world they live in. They don't realize America needs the world and the world needs America.
The name of my show is called Us and Them. What are your thoughts on this idea of us and them, and what has been your experience between the divides that maybe the pandemic has kind of widened?
Yes, people have become more selfish, and it's the opposite effect of what I expected. When you have been threatened, your life have been threatened by a bug, wouldn't you think instead of focusing us and them, focusing all human beings, we were on the same side, facing the same battle? When we suffer, when one suffers, it doesn't matter how far it seems, it is not so far.
Just recently, a new variant of COVID called Omicron proves that point. In places of low rates of vaccination, the virus mutates, creating new strains. That puts existing vaccines to the test. Will they provide enough resistance? When Amitoj Singh went to his father's house in northern India, that country was facing its second wave of COVID.
All around me were medicines, medical equipment. My father was in a frenzy, every 10 minutes receiving a call from a family member or making a call to a medical professional, asking for the next steps of how to treat her. Constantly trying to figure out whether there would be a hospital bed that would be available or not in the next few hours if required, and should we move her or not.
That Indian term, Amitoj, taught me, comes to mind. Jugaad, figuring a way out.
I kind of get the idea of jugaad. It sounds like that's what your father was doing.
No. This is the first time in the history of India that I feel, or at least in the time that I've lived, that jugaad did not work. There was just nothing anybody could do. Delhi was literally a death zone. People were just dying left, right, and center. Every single household had COVID. If not everyone, at least one member of the family had COVID in each household. And I'm talking about personal friends, I'm making calls to them and they're like, yeah, my grandmother, my grandfather, my wife, my daughter. All around me, I've heard news of friends who've lost their fathers. My granduncle is dead. His family is unable to get him to a funeral pyre. His body is lined up in a queue of bodies at a cremation ground in Delhi. There was a baby who was found next to her dead mother's body 2 days after the mother had died. So there were all kinds of horror stories emerging. The town that we were in, I had come to understand there were an increasing number of deaths being reported. And at some point, me and my father made an executive decision.
They called an ambulance to take his 93-year-old grandmother to the nearest hospital where they thought they might find a bed. It took 3 hours on hilly roads.
At about 1 hour into the journey, the ambulance stopped and they couldn't get the oxygen to work. So we waited 15 minutes and the oxygen came back, thankfully, while her oxygen was dropping. So it was a bit of a scary moment.
When they got to the hospital, it was not good.
They were very angry because we had come in with the idea that, okay, we're going to get the hospital care. So we were just like expecting that. And they were like, wait, hold on, what care? We don't have a lot of the facilities that you might imagine we have. We don't have a CT scan. We have only 9 regulators for 30 patients, which means we can only regulate the oxygen levels of 9 people. We have 2 attendants for 30 people. And those attendants had not been paid for 5 months. So they were just like, what the hell are you doing here?
Doctors told Amitoj and his father to go home, but they'd already given their oxygen equipment to someone else who needed it. Amitoj says finally the hospital accepted his grandmother as a patient. After 3 days in the hospital, she improved and doctors released her. But the next day, she started declining. Amitoj and his father took her to a local government hospital.
And they just gave her oxygen. And they couldn't do anything else.
They suggested taking her to a bigger hospital, 2.5 hours away, where they might get a bed. While Amitoj and his family debated their next move, they took her home.
We put her back in the ambulance. It was a 5-minute journey from the hospital to our house. She entered the house. I think she was still breathing as I picked her body up out of the ambulance and took it to her room. As soon as she entered and we put her on her bed, I felt she had gone. I shouted out to my father, who was on the phone, hey, I think she's gone. And there was nothing. Like, her chest was not moving up and down. Her mouth was open. Her eyes were open. Her neck was leaning towards her left shoulder. Her hands were just lifeless. I was... my father called up his sister to tell her at that moment, and I said, no, she's not dead. Stop telling people she's dead.
Amitoj thought he felt a pulse. A family friend, a nurse, began giving CPR.
My father said to stop at some point. He said, I can't see this. And he made the executive decision to declare her dead, in a sense.
First of all, I'm so sorry that you had to go through that. It sounds hellish.
It was just it was very numbing. It was a feeling where you realize you can't do anything. I think that was the worst for me. I take myself to be somebody who can help others, but I wasn't able to. And despite the fact that I thought I was this hero who was flying in from New York, I couldn't do shit. And that was the worst for me, actually, because I couldn't save my dad's mother.
Many Americans don't really see or experience the type of things that are happening in parts of the world They just don't understand the experience of what you've just gone through.
We didn't sleep for days. And I think America had it bad. I was there in March and May and April. America really did have it very bad. But there was nothing like what India and other parts of the world have suffered, because there's a system. There are ambulances that will show up. There will be medical professionals at the front lines helping you. There will be no shortage of medicines or, having to travel 3 hours away to get a hospital bed. I know so many friends and family members who decided to just stay at home and died. So that is something that Americans just don't get. There's a lot of wow, there's a lot of, oh my God, I'm so sorry. It's disingenuous because it's sincere empathetically, but when you're doing nothing about it, then it's not sincere. I just want to remind the Americans that, look, India is producing 60% of the world's vaccine. And India had given a lot of its vaccine before the second wave. It had not kept it for itself, while America had. And you were getting your second doses while we hadn't got our first. And you were running to get it, including myself. And the funny thing is, I, as an Indian, was Americanized, living out there for 1.5 years. So it's very nuanced. You take what you're getting and you don't raise your voice and say, what the hell? What about the rest?
What about the rest? That question has stuck around in my head. It's the question I asked myself when I got my booster shot, knowing many others around the world hadn't even gotten a single dose of the COVID vaccine. If there's no us and them in this pandemic, then what's going to happen to the rest of us who aren't getting the resources needed to fight the virus? I posed this question to Dr. Wafa Al-Sadr, director of the Global Health Center at Columbia University.
What do you see as the end game to this pandemic? I mean, is the goal to get from pandemic to endemic?
I think that's the most realistic goal. I mean, I think in a lot of ways, I think that's what most people believe, is that the countries of the world will fit into two groups. There'll be the group that highly vaccinated countries that continue to have transmissions. We're not going to eradicate or eliminate this virus anytime soon. So they continue to have transmissions, but they don't have severe illness. They don't have the hospitalizations and so on, because they have a highly vaccinated population. And then you're going to have other countries that don't have access to vaccines that continue to have these surges, that happen every now and then with dire consequences because they have an unvaccinated population. There's going to be the privileged and the people who are unfortunately continue to be the vulnerable ones. And that's going to be determined, largely by access to vaccination.
Is that in many ways just the way of the world, that in many ways that's just the way it is? There is an us and them divide.
Oh, I don't believe in this. I think I spent my whole life breaking that perception. And there's been enormous progress that has happened because we've said no to that premise. No to the premise that there will be the healthy and there'll be the unhealthy. There'll be people who live and the people who die.
But when you say that you don't believe in it, is it a reality that is there that you have to continue to grapple with? This us and them divide?
I guess maybe better response would be it's something I cannot accept.
In late 2021, the Biden administration announced plans to dedicate billions of dollars to vaccine manufacturing in the U.S. The goal is to produce 1 billion doses a year. Part of the motivation is to increase the global supply of vaccine. But the White House says the aim for future pandemics is to have enough vaccines for all Americans. The United States has now pledged to donate more than 1.1 billion doses of COVID vaccine to other countries. As of mid-January 2022, about a third of that has been shipped out, with the number continuing to rise. You've been listening to Us and Them. Our team for this show was me, Trey Kay, Emily Havik, and Kate Smith. Special thanks to Templeton Kay, Nikki Linganor, Saeed Garad, and Nicholas Lemon. Michael Lipton and Tristam Lozow wrote and performed the Us and Them show music. Mark Lerner designed our logo. Lelena Price provides us with images for the web. And Jane Sears Wright does the invaluable work of securing our funding. The marvelous people at PRX and West Virginia Public Broadcasting make Us and Them possible. So do grants from the Corporation for Public Broadcasting and the CRC Foundation. This episode was made possible by funding from the National Endowment for the Humanities and the Federal American Rescue Plan Act of 2021 through the West Virginia Humanities Council. Any views, findings, conclusions, or recommendations do not necessarily represent those of the West Virginia Humanities Council or the National Endowment for the Humanities. Us and Them was originally developed with assistance from the Mentorship Program at AIR, the Association of Independents in Radio. We'll see you next time on Us and Them.
Support for this podcast comes from the Corporation for Public Broadcasting.